Good morning, and thank you for joining us today for this Facebook Live media conference. We have three speakers this morning: Dr. Mark Davey, the District Superintendent and CEO of Champlain Valley Educational Services, BOCES; Dr. Wouter Rietzema, who is the CVPH Vice President of Population Health and Information Services and an infectious disease physician; and Ms. Erin Strife, our Director of Healthcare Services here at the Clinton County Health Department. Each of them will have some prepared remarks to make, and then we will take questions. We also have Mr. John Canosa, Director of Public Health here today, and Mr. Eric Day, Director of our Office of Emergency Services, and they will be able to respond to questions that are appropriate, and we'll just, after the prepared remarks, there'll be an opportunity for those questions to be asked, and then whoever is best suited to answer them will step back up to the podium. Just wanted to let you know that, again, since we anticipate there may be some duplicate questions, just please listen carefully as your question may be put together with somebody else's and given in a response in that manner, or maybe in the prepared remarks that will be delivered today. At this point, I would like to invite Dr. Davey to the podium. Thank you.
Good morning, everyone, and thank you for the opportunity to allow me to be here on behalf of our BOCES and our 16 component school districts. I appreciate the opportunity to provide an update on our schools and what's underway. As our school districts have worked together and very closely, and I want to acknowledge and thank our Department of Health, both in Essex and Clinton County, for their strong leadership and work. We've been a strong partner in working with our health professionals and our school communities to continue to provide education to all of our students while there's been a remain at home and school closure order by the governor. Just as an overview and a reminder, our 16 districts, which make up Champlain Valley Educational Services, include 16 school districts with over 14,000 students. During this time, we have been operating under the auspices and the oversight of the governor, who has closed all schools in New York State through the 15th of May. So through the 15th of May, and that's been done through executive order by Governor Cuomo. We are continuing to cooperate and work closely together with all of our schools and our school community and parents to provide instruction remotely during this time. I do want to provide a strong shout out and appreciation to all of our school professionals who are continuing to work very hard, remain in close contact with our parents, and continue to provide instruction in new and innovative ways during the school closure. My hat goes off to everyone, and we're very appreciative of that, and all of our parents who have been working closely with our school teachers, with our administrators, to continue to provide instruction. And that's been very, very important. Under the governor's plan and under our school closure, the schools have been responsible to provide and to support three different plans. One is a continuity of learning plan, and that's something where all of our schools, our teachers, are working with parents and students to provide learning remotely and at home. Second, we have been asked to provide nutrition plans and to put together school nutrition to provide meals to all of our students who are in need in our school communities. We have continued to provide meals to students from throughout our school communities, and that's been done in a variety of ways, including home delivery and pickup. So in many cases, our school buses have been continuing to work. Our school cafeteria folks have continued to prepare meals, and those meals are either being distributed via school buses or also being picked up. So there's the continuity of learning, there's the nutrition plan, and lastly is the child care support. And the school districts have also been responsible to develop child care plans where we are working with our community providers, and I want to thank those folks and all of those providers for working with us so closely to ensure that there is child care for our first responders, for our emergency workers, and so on and so forth. And that has been happening. In Essex County, ACAP has been helping coordinate those efforts. For Clinton County and Franklin, the Child Care Coordinating Council has been working very closely and providing strong leadership. Also with the YMCA and the United Way has been assisting, and there's been a significant effort in coordination to support the child care needs for our region. So I'm very appreciative of everyone for that and continuing to support the child care needs. I would share with you also that we have continued to have conversations on a regular basis with our superintendents and our administrators to look at how we can continue to improve the remote learning and continue to work together for a variety of all the discussion points that do come up during this time. As I mentioned, the school closure order under the executive order is through the governor, and that is that schools are currently closed through May 15th. And we will continue to support the school closure and continue to support our different pillars of providing education during this time. Thank you.
Good morning, everybody. I'm Wouter Rietsma. I'm a vice president at CVPH. So just a few comments. First of all, as always, I want to thank everybody in the community for the support that CVPH has received. And we have received support in so many ways, from school kids. We've received support in sewing cloth masks for our people. We've received all sorts of donated meals through businesses. It's impossible to count off all the ways that our community has supported us through donations to the foundation, and so we're extremely appreciative of that. And I know the teams that are actively involved in caring for COVID patients and all the other patients that we have, because care goes on. Everybody is appreciative. Speaking of other patients, I think one of the weird things that's happened across the country is that many hospitals have seen their volumes of emergency cases, non-COVID, go down. And that their overall emergency room volumes have gone down. Now, some of those emergency room volume patients are probably patients that never needed to be in the ER, but they've even been seeing fewer serious illnesses. And this is of concern to us. It's possible that there are fewer serious illnesses happening. It's also possible that people are waiting too long. And I want to deliver the message that we are still open for business for emergency and urgent care. And if you feel you need emergency or urgent care, please come to our hospital. We can provide care, and we can provide care safely for non-COVID related illnesses. So just to make that point. The other thing I wanted to say is that we are now opening up our testing capacity. Testing is still a hot button issue across the country. I know we are seeing improved capacity both through the state, but also through our partners in the University of Vermont Health Network. The lab at UVMC has been very supportive. So we have opened up testing now, available on a daily basis with a physician's order. And we're open for that testing midday. It's, I think, 3 hours, might be 10 to 1 or something like that, but your physician office would be able to tell you, and we can do routine testing. It's not immediate turnaround. It's still 1 to 2 day turnaround on the result, but we're able to provide that. So if patients are worried that they might have an illness that's COVID, they should contact their doctor, and I'm sure they can get an order for testing. We do not have antibody testing yet. Antibody testing is not routinely commercially available. There's a lot of talk about it. The state did an antibody test survey, but it is not commercially available at this point in time. I know that's the goal. We don't have it yet. I wanted to move on to how we're thinking about this particular outbreak. So I think back to how I've been thinking about the outbreak, and I remember back in February when I really started to wrap my head around it, and I thought, oh my God, we are going to be overwhelmed. We are not going to have enough people. What are we going to do? And then I remember when I realized there was going to be a surge, but contrary to not having enough people, we might have too many people because we shut down everything else we were doing. And that was a new level of concern. And then there was a point in time where we were looking at the numbers and realizing that we probably weren't going to see that horrific surge that everybody was worried about, and we weren't going to need all 30 some odd of our ventilators, even if we had given some to New York. We weren't going to need all that. And now we're sort of entering a new thought about what this looks like for the future. Certainly, I think the community is thinking about that, promoted by the governor's talk about starting to open things up. But I want to caution people, opening things up, I'm not talking about what the governor might allow or not, but it's our belief, and we're not special in this, that we will be living with COVID in our community until there's a vaccine. There's no reason to think it will go away. It's not just going to drift away. So we're planning for the idea that we will always have a small census of COVID patients in our hospital. It might range from 0 to 5. That's just a guess, but that's what we're thinking. And that's a best case scenario. A worst case scenario is that everything opens up too quickly and we end up with a new surge. So we're trying to think about how do we do that, because we also are going to be opening up services. We're starting to plan for that in the hospital, and we're also thinking about it, from a community perspective. What do we expect? And I think we expect that there will be low-level activity in the community. It will place a premium on a couple of things. That will place an incredible premium on our friends at the health department to be able to do aggressive and early contact tracing and quarantining, if we use that language, or voluntary isolation, whatever language will be used. But we're going to have to do that, especially if things are starting to open up. The other thing that I think people need to wrap their heads around is this: masks. Masks, do not think that if the stay-at-home order gets lifted, whether it's May 15th or another date, that this will go away. In fact, if you start opening up things, one of the most important public health things we can do, other than trying to maintain social distancing, is wearing a mask. It's called universal source control, and it's critically important. And we're talking to our staff about how a mask is now part of your clothing, and you're expected to come to work with your mask, just like you're expected to come to work fully clothed. So I think that's something that people need to start thinking about. This is not going to go away, or it shouldn't go away, is what I'm saying. The most important thing is universal source control, which is you wear the mask not to protect yourself, you wear the mask to protect everybody from you. We know that there is some asymptomatic COVID. We also know that people are infectious for a day-ish before they actually get sick. And since we don't have a little thing on our phone that tells us when we're going to get sick, that's a day that we're very infectious. So that's enough of my comments, and I'll take questions afterwards. I'm sure there will be some.
Thank you, Dr. Ritzema. My name is Erin Streif. I'm the Director of Healthcare Services for the Clinton County Health Department. I'll start with our numbers. 58 confirmed as of this morning, still at 3 probable and still at 42 suspects. So that gives us 103 total cases. 84 of those have recovered, 4 have died, but we are now at 15 active cases. We do not yet have the county-specific results of the antibody testing that the New York State Department of Health conducted this past weekend. So I checked at 10:22 and there was nothing yet. We'll continue to check throughout the day, and as soon as we have those results, we will be sharing them. I also was planning to address moving forward, as Dr. Ritzema just did, what our lives are going to look like after May 15th. And I wanted to talk about 2 aspects of that. One was the practical, and the other is idealistic. Dr. Ritzema did the practical for me. That's exactly what I would like to say and reemphasize. This virus is going to continue to be a part of our lives, and we're going to have to continue to take precautions to prevent infection, but infections are going to continue to happen, and we at the health department will continue to work tirelessly on containment measures. So now I can jump to the idealistic. This pandemic has brought forth both fear and heartbreak, but we can choose how we face our future. We are being compelled to examine our social foundations right now, and so a friend of mine showed me a video clip of the greatest speech ever by Charlie Chaplin, and I'm going to paraphrase it because it applies very much to us right now. Humans want to live by each other's happiness, not by each other's misery. Technology has brought us closer together. The very nature of it cries out for universal association, for the unity of us all. So to those who are listening now, I say, do not despair. You have the love of humanity in your hearts. You, the people, have the power to make this life beautiful, to make this life a wonderful adventure. Then let us use that power. Let us all unite. Let us fight for a new world, a decent world that will give us a chance to work, that will give youth a future and old age a security. Let us fight for a world of reason, a world where science and progress will lead to all of our happiness. Please remain optimistic, but do not become complacent. This is how we are going to continue to overcome challenges, and this is an opportunity for us to become even better than we were before the pandemic. Thank you.
Okay, so we're just going to jump into a few of the questions that we have received. One of the first questions was, most people are wearing face coverings, but some are not inside stores, and they mentioned such as Lowe's. Should the businesses not let people in if they are coming into the store without a face covering?
Stores are not required to refuse entry to non-masked individuals. Many stores do have policies, and they're making announcements reminding all of us to keep our masks on and to maintain the 6-foot distancing. There are mitigating circumstances in which some individuals can't tolerate keeping a mask on. So while I certainly understand we need to encourage each other to take precautions, there are situations where for one reason or another someone might not have a mask on. It doesn't necessarily mean that they're a criminal. It is just best practice that we continue to wear masks to protect each other.
With the Canadian border, the question was, is the Canadian border still closed? And they mentioned, I saw a gray regular van with Quebec plates coming out of the shopping plaza headed for the highway on Route 3.
The border is open to essential workers. There are people who are allowed to pass for various reasons. Those determinations are being made at the border by our Customs and Border Protection, and they have been doing an absolutely stellar job of protecting us, and that's going to continue for now.
One of the next questions we have, will we find out if most of the active COVID-19 cases are at the senior living apartments?
Are not at the senior living apartments.
Another question we had, what are the expectations regarding children wearing masks?
Do you want to talk to that, or I can? Okay, so children under 2 cannot wear masks. It's not recommended for any child under 2. There is an expectation that if a child over 2 years of age is going to be brought into public, that they should have some type of face covering on. And if the child feels very uncomfortable in a mask, maybe a bandana or some other less restrictive covering could be used, but the expectation is that people over the age of 2 who can tolerate a mask should have a mask on.
Thank you. There was a question asking, what about youth sports this summer?
Do you want to speak to that at all? Okay, I'm gonna go. Ready? Youth sports are difficult to conduct while maintaining social distancing. I cannot specifically say what the governor is going to decide on this, and right now we're taking most of our direction from the state because we're in a state of emergency still. So I think that youth sports are it's probably early to be thinking about whether we're going to proceed on that sort of idea where we're all going to be congregating again. We have to take this slowly. We have to see how things unfold.
Another comment we received, the CDC warns of a resurgence of cases in the winter. What concerns does this raise for the health department?
This virus is not like any other virus that we at the Clinton County Health Department have worked with in the past. So we do see cyclical patterns in influenza viruses. There's some speculation that we can expect to see the virus maybe become less predominant during the summer months and then reemerge during the winter months. There are a number of different reasons why that may be the case, but we at the health department are going to continue to plan on implementing the contact tracing, the isolation, the quarantine, all of the containment measures that we've been doing for the foreseeable future.
Thank you. Another question, we received a couple of comments asking us to reinforce that no one should ingest or inject Lysol, Clorox, or any other disinfectant products.
Yes, please do not ingest any type of product that is used for environmental cleaning or any type of product that is not specifically directed for ingestion or injection into the skin. Please do not take it upon yourselves to experiment on yourself with any of this manner of theoretical treatment. It is absolutely not recommended. Do not do it.
We have received multiple comments from residents about concerns about schools remaining closed for the rest of the year. The concerns basically being that they do not want to see them opening. Is that anything that we can speak to at all?
Sure. And again, Dr. Mark Davey, CVS BOCES District Superintendent. At this point, as I referenced at the initial part of my comments, schools are following the leadership of the governor. Schools are closed through the executive orders. Originally, when the outbreak first hit, we did work in collaboration with our county health departments for both Essex and Clinton County, and they were phenomenal to work with. And we did close our schools at that time under state of emergency orders from both counties. The governor then stepped in a few days later and closed all the schools in New York State. We have continued to follow the executive orders since that time, and currently the schools are closed until May 15th. So the potential reopening date could be May 18th, which would be a Monday. With that said, our superintendents, as I mentioned, are continuing to work together on a regular basis, and we're having discussions. We're working together as a group to have conversations about potential reopenings. Again, we're taking our leadership from the governor. Our first concern, and I think everyone's first concern, is the safety of our students, safety of our staff, and then our school communities. So that's definitely part of the conversation as well. There are no concrete plans at this point. I would say that that's in flux, and we're waiting to hear further updates on behalf of the governor and the state. As the district superintendent, I am one of 37 district superintendents from around the state, and the district superintendents have as a group have been asked to gather resources that could support or that could provide information about what would be needed if schools were to reopen. There are no concrete plans at this point that have been developed, nor has there been any formal plan put in place. So at this point, we're following the governor's order, and we will continue to do so and provide feedback and information. Okay, thank you.
So this is where I'll just throw in my personal opinion that opening schools would be folly. It would be crazy. Not just the safety of the children, and not just the safety of the staff, but the safety of everybody at home that the children will come home to. Some of those people work in essential services. Some of those people work at hospitals. We will eventually have to open schools, and we will eventually have to open schools while COVID is still circulating. We will also, by that time, have a lot more data, a lot more science, a lot more rapid testing capacity where we can do real-time rapid testing, and we will be better prepared. So we are not yet as good a job as the health department is doing with contact tracing, as good a job as CVPH is starting to do with testing. We are not prepared for that yet as a community, and we will see a surge in this community if we open schools. That's my personal opinion. I do not say this on behalf of CVPH, but I think probably many at CVPH would share that opinion. So.
Thank you. One of the last couple of comments that we have was a question more in regards to reopening. So one statement was, if the governor opens the North Country, what will stop people from traveling here and causing more spread? One of the other comments that's related was in regards to marinas opening in the local area, and stated that they are campgrounds on water with large out-of-the-area populations that travel here on the weekends. So again, just concerns related to things reopening.
Reopening is going to have to be phased. It's going to have to be done very slowly and carefully. And as we see things begin to open, if we observe patterns of increased rates of infection, we're going to have to move backwards again and start closing things again. It's going to be very much a give and take between balancing infection rates and balancing reopening. So it will be an ongoing process. Thank you.
I think one of the last comments that we had, and I think this will be the last question for the day, was in regards to COVID-19 and our local nursing homes. So just questions in regards to their efforts that are happening, and I don't know if we have any speakers that can speak to that at all.
So obviously nursing homes have been a hot button issue across the country. There have been numerous very severe outbreaks. I'm aware of a number of nursing homes in the Glens Falls region that have had very severe outbreaks, and I know that there is at least one nursing home in the Burlington region. We've been fortunate. I think we've probably been fortunate for a number of reasons. Number one, the burden of COVID in our community is not great, and it's certainly not as great as certain other parts of the state. I think the other thing is just luck, and then we have nursing homes that have done a really good job of implementing the guidelines of the governor. So I did see this morning that the governor in the state is going to be doing an investigation of whether or not nursing homes that have experienced outbreaks actually implemented the recommended controls. I know that all the nursing homes in our community did do that, which one of the recommended controls, by the way, is that all staff are wearing masks. So if you think of the nursing homes, the only way it gets in is from the staff. And so if you do what's called universal source control and you mask the staff, you protect the residents. So we're fortunate, I think, our nursing homes had the PPE, had the masks available to do that, and our nursing homes did that. There's also a little bit of luck involved, and we've been lucky. That is an ongoing worry. I haven't talked with Erin, but I am sure it's a worry of the health department. As we go to this low-level community situation, the worry is for what I call forest fires. And the forest fires will pop up. And where are they going to pop up? They're going to pop up in areas where there's congregate living. Nursing homes, adult homes, prisons. This is where we're going to see outbreaks, and this is where it's going to be critical the health department to investigate, and for all of those congregate living facilities to follow their recommendations and to monitor their people and their staff.
Thank you.
Thank you for joining us today. Thank you to our speakers for their remarks as well as their responses to questions, and thank you for your questions. I did want to just take a quick moment to address that within this room today, we've seen our speakers as well as the few other staff that are here come in with their masks on. We take them off so that we can speak more clearly to you. But I wanted to reassure everyone that we are taking distancing and mask precautions here. We have a fairly large room. It allows us to spread out. And we have hand sanitizer on the table that each of us is able to use as soon as we step back away from the podium. Even in preparation for this live stream, we have a meeting that happens here earlier in the morning, and the moment that is done, the staff goes to work resetting the room, but also disinfecting the room. So we appreciate that our speakers and our staff here are doing that. We appreciate that our community are taking those steps, and I just wanted to say thank you, as well as to say thank you for those people who have supplied us with masks, because we do have some very nice cloth masks that have been made for us, and they're very nice to wear, and we want to say thank you again for those. Thank you.